Good afternoon, Dr. Berger.
Good afternoon, Irina.
So, while I'm coaching many patients, I get the feedback that I cannot meditate and it's not for me. I hate meditation. Can you talk a little bit about the importance of mindfulness? It's one of the pillars of lifestyle. And why is it important for us to unplug?
Of course. In general, management of stress is one of the pillars of a healthy lifestyle. A couple of reasons for it from a physiologic point of view. So, stress really in two forms. You have an acute stress, a tiger jumps out at you and you need to run away. And you have chronic stress, like all the worries and concerns that we constantly ruminate about in modern times. So, 10,000 years ago, it was acute stresses that were the issue, and that's what our system is designed to do. So when something jumps out at you to bite you and eat you, your cortisol level goes up. Cortisol is a stress hormone. It makes sugar available to your muscles so that you can run away. It increases your mental acuity. It helps your vision. All the things you would need to try to run away from a predator, for example. The problem is that when cortisol is elevated chronically by chronic stress, anxiety, worries, etc., those same things are happening, in particular the elevation of the cortisol, the elevation of inflammation. If you've ever taken prednisone, which is a synthetic steroid that's used to treat a lot of different conditions, and then had your blood pressure checked, you've noticed it's a lot higher. So that's what steroids do, and so the natural one, cortisol, increases your blood sugar, so that can lead to prediabetes, diabetes. It can also lead to weight gain. So in terms of one's weight and having a healthy level of adipose tissue, chronic stress is something that we want to control. And of course, we want to feel good and not be stressed, as we say. So yes, one of the ways to try to control that is through mindfulness or meditation. There are lots of different techniques, lots of different ways that you can access them. It doesn't need to be done with an instructor on a retreat, this kind of thing. There are a lot of online apps that are available, that some go from being relatively simple and straightforward, some to very broad with all kinds of different people leading the sessions and so forth. And while I don't endorse any particular one of those apps, Headspace and Calm are two that are relatively low cost that some people like. A more in-depth one is called Waking Up by a neuroscientist and Eastern meditation expert by the name of Sam Harris. Again, I have no financial involvement with any of these, just three that I know have been helpful to patients. But it can be hard to quiet the mind, no question. Meditation may not be for everybody, but also it might be that a person just hasn't found the right guided style of meditation for them. In addition to mindfulness and meditation, though, exercise, particularly in the morning, can be very helpful. Getting out in nature can also help to center oneself and make you more mindful. So a lot of different techniques, but in general, whether it be exercise, whether it be a guided meditation that you can do on your own, and of course, more psychological techniques like cognitive behavioral therapy, and there's always medicines too for people who truly have generalized anxiety disorder and things like this. It's very important to try to control that stress level, not only so that you feel better mentally, but also for your metabolic health. So, and again, one of those pillars of lifestyle that we constantly focus on here in our practice is management of stress. Meditation can be one good way, also exercise, exposure to nature, time with your family, sometimes stressful, but hopefully not all the time. If you'd like to learn more, please don't hesitate to reach out to us in the office, 516-604-3418, or online, northeastmedicalpractice.com. And bear in mind that everything we share in these podcasts is for informational purposes, educational purposes only. No doctor-patient relationship has been formed, and if you have questions, concerns of a medical nature, don't hesitate to reach out to your medical professionals. But until we see each other again, don't be stressed and be in good health.
Thank you.